Hey everybody, I'm Dr. Steve Schlintz here at Harmony Dental Health, and I want to welcome you to this video today. And actually, what I'm going to do on this video is show you sometimes things aren't always what they appear. And what I mean by that is we have a lot of patients that come in that have what appear to be good teeth, right? Good alignment, good function, etc. But things keep breaking, falling apart, unnecessary root canals, crowns, more fillings, and you start to ask yourself, why is that? And this is a classic case of that. So if we're looking at this scan, we're going to show you these front teeth right here. So just to kind of get a comparison, I'll show you the side-by-side view of the top and bottom teeth in full arch form. And then also if I get rid of that and I go back to the way that this patient bites, you'll get an overall sense of what these teeth look like. Now, if you saw this patient and she smiled at you, you would think, okay, good teeth, right? Like nice teeth. I want you to look a little bit further. And if you're a patient that's struggling with, teeth that are constantly breaking, crowns, root canals, pain on your teeth, sensitivity on your teeth, crowns that aren't staying in, they debond, sometimes it's a bite-related issue. And so what I want to do is actually show you what this patient has been experiencing and struggling with and why I think that is and how we could best help her. So if we look back at her smile again, and this is her teeth just basically biting together, you'll see that the teeth actually have a pretty good relationship. I want to show you where the problem lies, okay? And in order to do that, I'm going to rotate her teeth to the side. So what you're going to be looking at is her back right teeth, okay? Or back left teeth, back left teeth. This is where the problem becomes very, very apparent. She has a very collapsed bite. So basically what that means is there's not a lot of space between those back teeth. And if I go to the other side, you'll see that she has a little bit more space. And what I mean by space is back here, these molars, right? This top right molar and bottom right molar have more thickness to them, more space, right? If I go to this other side, you'll notice that her bite is collapsing. So her teeth are getting very small. And even when we have to do restorative work, we have to make that restorative work very small, crowns, fillings, etc. So something's happening with her bite. Okay, her bite is literally collapsing. Now what happens is you look at the front and you go, everything looks good. So I want to peel back the onion just a little bit so you can see what it is that I'm seeing. Now you're not going to obviously make an assessment in the mirror and say, I think my teeth are too short or too long based on what I'm seeing. But as a dentist, I'm trained to look at these things, especially a dentist that spends a lot of time looking at bites, TMJ, muscle disorders. I notice some things that maybe you don't always notice. So I'm going to go back to that one frame of reference that we had before. Actually, what I'm going to do is I'm going to eliminate the top teeth here, okay? Because I think that this is where you really can see a problem. These are her lower front teeth. And just to give you an idea, from where the tooth emerges from the gum and the top of the tooth, that should be about 10 millimeters. And we don't have a ruler on the iTero scan, but I can tell you right now, that tooth is not 10 millimeters long. It's probably about 7. And that is a problem because what's happening is if I take these lower teeth and I rotate them towards me and I zoom in, and I'm going to try to do this with a mouse here, and I'm going to zoom in, you're going to see that there's some wear patterns that are developing on her front teeth. So basically she's losing dimension in the front, which is impacting her back teeth. And so then what you see is all of this dental work in the back. She's got old silver fillings that are breaking down. She has a crown back here that it's so thin that the lab had to make a metal top part of the tooth, because if it made a normal crown that looked like a tooth, there wouldn't be enough space. And what would have to happen is you'd have to reduce the top tooth on above it to get space for a crown. And I personally, I don't like doing that. I don't like to adjust another tooth to fit a crown onto a tooth that's existing. But these are signs that she does not have enough space on her back teeth, and it's going to create a lot of issues. And so that's exactly what we're seeing. So the reason that I bring this case up is this crown on the back, this bottom left crown, will not stay in. Doesn't matter what cement we use, how we prep the tooth, the crown has a hard time staying in. And that is a byproduct of just having not enough height on the tooth to be able to support a crown. Okay. So when I look at this, and what I want you to get out of this video is that there are times where you look at your teeth and you think, yeah, they look good. There's no issues here. I'm not in any pain in my front teeth. My teeth are straight. But you can always look a little bit further. And so if you're having issues with teeth that are breaking down, or a lot of crowns, a lot of root canals, sometimes what it is a bite issue. Her teeth just simply don't have enough space. And so if you look at this picture here, this video camera of her teeth, you're going to notice this is where you really start to pick it up, because you'll notice right here on this corner, okay, the inner part of the tooth is a little bit darker and it's a different material than the outer part of the tooth. And what ends up happening when your teeth wear is that they'll start to develop almost like rings. So when you look at a tree, you can tell how old the tree is by how many rings are on the inside. The teeth function the same way. If you see an inner line on the inside of the tooth, you know that that tooth is worn and it's starting to show its quote-unquote age, right? So the question then becomes for a patient like this is, how do we best take care of this situation? Well, I can tell you what the answer is not. The answer is not crowning every tooth in the back of her mouth, because most likely if we don't do anything with her bite first, and we only do, her bottom teeth, for example, we're going to run into the same issue that we ran into on this back crown. The proper way to address this is actually start to look at, let me get rid of this so I can have both teeth together. The proper way to address this is actually to create a better bite relationship on all of her teeth first and create the necessary space needed for her to function. And then when we're done with that, and that would be with Invisalign or clear aligners or even traditional orthodontics, once that's done, then we can go back and actually fine-tune her bite to create a better bite relationship for her, where the teeth have the proper length and the proper shape so they can function right. Because what's happening now for her, because she has such a collapsed bite, is that all of the anatomy on her back teeth is becoming very flat. There is no anatomy left in the teeth. But on the premolars and forward, as you go more towards the front, you'll see that you still have some natural anatomy there. But as you get in the back areas, there's no anatomy left. The teeth are completely worn down, they're completely flat, and it's creating issues for her. Okay? So the first step is we align the teeth and we create an ideal bite relationship for her in the space that we need. And then second, what we do in this case is actually systematically, whether it's through fillings, crowns, some reduction of certain tooth structure to add to other tooth structure, there's things that we can do as dentists. Then we go and fine tune her bite now so that the teeth have the proper length and the proper function. When we straighten the teeth first, create the space we need, and then add back to the teeth with the materials that we can use to replace missing tooth structure, we can create a much more balanced, functional, systematic bite for this patient that also looks great, and she'll have longer teeth, which match the anatomy of the teeth, what they used to be like before. Because, for example, these bottom front teeth, they're worn down. She has short teeth, and that affects her smile and her bite. So that's the steps we go through, and I wanted to highlight this case because oftentimes if I get questions about Invisalign or something along clear aligner therapy, it's because the teeth are really, really malaligned in the front and the patient wants to correct that. That's awesome. But there are times that Invisalign and clear aligners are indicated for bites like this, where we need to get everything straight and then create the proper space and then add back what's lost. I do want to touch on one other thing in this video before we hop off. And you might be asking, well, I see a little bit of wear in the front, but where else do you see the wear? Why do you see a problem? And I actually want to highlight these canines because if you actually look at this lower right canine for this patient, it becomes very evident. You'll see that this part of the tooth right here in the front, it's unworn. It's rounding to a point, and that's what we want to see. On the back here, it's completely flat. Nature doesn't like flat, straight edges. It likes rounded curvature. And so when I see that flat edge, I know that she's wearing this area. And if I look at the other canine on the other side, she actually has, this canine is completely flat. It's completely worn down. So she's probably lost at least 2 to 3 millimeters of tooth structure, which is, it's about this much. So you might not think that's a lot, but in dentistry, that is a tremendous amount of tooth loss. And that's affecting the rest of her bite. So those are things that we look for. These are hidden signs and symptoms of bite issues that may not be apparent. Like I said, a lot of times patients come to me, they're interested in getting their teeth straight because they got crooked teeth. But this is a classic case for clear aligner therapy followed by additional tooth structure in the case of either composite material or bonded ceramic to build back the bite the way that it's supposed to be. So hopefully you got value from this. As always, you can check out my other videos. We talk a lot about TMJ, occlusal wear, and this is great for not just dentists, but also patients just like you. If you're in the Fort Washington area in Pennsylvania or the Philadelphia area or the Northeast in general, we'd love to be able to see you in our office. We got links to our practice as well. And with that being said, guys, I'll see you at the next video.